Good day, I am Trisha Maynario, BSN 3A of Union Christian College. Today, I will demonstrate suctioning the nasopharyngeal and oropharyngeal airway. The first procedure is bring necessary equipment to the bedside stand or over bed table. So here are the equipments, the PPE, the suction kit, the saline solution, the oximeter, and the patient's charts. Then second is perform hand hygiene and put PPE if indicated. Then the next procedure is identify the patient. So, good morning ma'am. Ako po si Trisha Mario, student nurse sa UCC. Your nurse for today po. Ano pong pangalan niyo?
Sandalin po, ma'am.
Anong birthday niyo ma'am?
April 12.
Pwede ko po bang makita yung identification band niyo? Next is close the curtain around the bed and close the door of the room if possible. So, for the privacy of the patient. Is determine the need for suctioning. Verify the suction order in the patient's charts if necessary. For postoperative patients, administer pain medication before suctioning. So, I will check the patient's chart if there are medication for pains. The next is explain what you are going to do and the reasons for suctioning to the patients. Even if the patient does not appear to be alert, reassure the patients you will interrupt procedures if he or she indicates respiratory difficulty. So, isa-sanction po natin yung ilong tsaka bunganga mo po ma'am para po maalis yung secretion po para mas madali kayong makahinga. Okay lang po ba? The next is adjust bed to a comfortable working position, usually elbow height of the caregiver. Lower side rails closest to you. If the patient is conscious, place him or her in a bedside table close to your work area and raise it to waist height. Semi-Fowler's position if patient is unconscious. Place him or her in the lateral position facing you. Next is place towel or waterproof pad across the chest of your patient. So, lalagyan ko lang po ng pad yung sa may chest pad nyo. Is adjust suction to appropriate pressure for a wall unit. For an adult, 10 to 100 millimeter of mercury. For neonates is 60 to 80 millimeter of mercury. For adolescents is 8 to 120 millimeter of mercury. And for portable unit for an adult is 10 to 15 centimeter of mercury. For neonates is 6 to 8 centimeter of mercury. For infant is 8 to 10 centimeter of mercury. For children is 8 to 10 centimeter of mercury. For adolescents is 8 to 10 centimeter of mercury. Then next is put on a disposable clean gloves and occlude the end of the connecting tubing to check for suction pressure. Place the connecting tubing in a convenient location. Since my patient is belong to adolescents which is 10 years old, I will going to use 8 to 120 millimeter of mercury. And I will going to use wall unit. So here. Next is put clean gloves. Then, I will check the pressure in the tubing. Then, put in the convenient location near the patient. Next is open sterile suction package using aseptic technique. The open wrapper or container becomes a sterile film. To hold other supplies, carefully remove the sterile container touching only the outside surface. Set it up on the work surface and pour sterile saline into it. So here are the suction kit. We're going to open it. Make sure that the outside area are not going to touch, so that it can contaminate. Then put the saline solution. The next is place a small amount of soluble lubricant on the sterile field, taking care to avoid touching the sterile field with lubricant packages. So here are the lubricant. So I will going to put here. This part is considered as sterile. The next is increase the patient's supplemental oxygen level or apply supplemental oxygen per facility policy or primary care provider order. So I will increase the suction pressure. The next is put on face shield or goggles and mask. The non-dominant hand will manipulate the catheter and must remain sterile. The non-dominant hand is considered clean rather than sterile and will control the suction valve or Y port on the catheter. So I will put the face mask for my safety. Then the face shield. I will going to remove the clean gloves and replace it with sterile gloves so that the suction materials can't contaminate. So here is the sterile gloves. Okay to touch it because this is also considered as sterile. The next is with dominant gloves hand, pick up sterile catheter. Pick up the connecting tubing with the dominant hand. Connect the tubing with non-dominant hand and connect the tubing and suction catheter. So this is my dominant hand. I will going to get the catheter. And with my non-dominant hand, I will going to get the tubing. Then, connect it. The next is moisten the catheter by dipping it into the container of sterile saline. So here. Next is occlude wide tube to check sunctioning. So here. So it's working. Then next is encourage the patient to take several deep breaths. Hinga po kayo ng malalim, ma'am. Sige pa po. Then next is apply lubricant to the first 2 to 3 inches of the catheter using the lubricant that was placed on the sterile field. So this, I will dip it in the lubricant. 2 to 3 inches. Next is remove the oxygen delivery device if appropriate. Do not apply suction as the catheter is inserted. The catheter between your thumb and forefinger. So here, I will going to remove the oxygen of the patient using my non-dominant hand. The next is insert catheter. For nasopharyngeal suctioning, gently insert catheter through the nares and along the nostrils. Toward the trachea, roll the catheter between your finger to help advance it. Advance the catheter approximately 5 to 6 to reach the pharynx. Next is apply suction by intermittently occluding the Y port on the catheter with the thumb of non-dominant hand. So here, and gently rotating the catheter as is being withdrawn. Do not suction for more than 10 to 15 seconds. So here. The next is, you can also suction the other side of the nose, but before doing it is, we should first flush the secretion in the saline solution. So here. Then, suction the other side. The next is replace the oxygen delivery device using your non-dominant hand if appropriately and have the patient take several deep breaths. So, ibabalik ko na po yung oxygen nyo. Hinga po kayo ng malalim. Next is the oropharyngeal suctioning. Insert the catheter through the mouth. So, here. 1, 2. Then next is flush catheter with saline. Assess effectiveness of suctioning and repeat as needed. And accordance to the patient's tolerance, wrap the suction catheter around your dominant hand between attempts. So I will going to flush the secretion in saline solution. So here. Then next is allow at least 30 seconds to 1 minute interval if additional suctioning is needed. 3 suction passes should be made per suctioning episode. Alternate the nurse unless contraindicated. If repeated suctioning is required, do not force the catheter through the nurse. Encourage the patients to cough and deep breathe between suctioning. Suction the oropharyngeal after suctioning the nasopharyngeal. So, here, I will remove the oxygen. Here. Pwede po ba kayong huminga ng malalim, ma'am? Then flush. Hinga lang po ng malalim. Then flush. Hinga po ng malalim. Hinga po ng malalim, tas ubo. Ubo po. Yan, mas okay na po yung paghinga nyo. Then, return the oxygen to the patient. When suctioning is completed, remove gloves from the dominant hands over the coiled catheter, pulling them inside out. Remove the gloves from the non-dominant hands and dispose gloves, catheter, and container with solution in the appropriate receptacle. The next is assess the patients to a comfortable position. Raise bed in rails and place in the lowest position. So first is I will going to remove this one. Then dispose it, including the Then next is turn off suction. Remove supplemental oxygen place for suctioning. If appropriate, remove face shield or goggles or face mask. Then perform hand hygiene. So I will going to turn off the suction. So here. Then tanggalin ko na po yung oxygen niyo. The next is remove the face shield. And the face mask. And also the gloves. Then, perform hand hygiene. Then next is reassess patient's respiratory status, including respiratory rate, efforts, oxygen saturation, and lung sounds. So I will going to use oximeter and stethoscope. So i-check lang po natin yung oxygen level niya po. Hinga po ng malalim. So, okay na po yung paghinga nyo. Bumalik na siya sa normal. And 97 na din po yung oxygen nyo. So, okay na. And lastly is remove additional PPE if used and perform hand hygiene. So that's all for the sunctioning of nasopharyngeal and oropharyngeal airway. Thank you.